Welcome back to movementprofessional.com. So this video is in response to a question I got regarding the 90-90 position, as it's referred to in the FRC world, or a Z-sit, which is the first way I heard it introduced, where you're basically in this ground sitting position where one leg is in external rotation and the other leg is in internal rotation. So the biggest movement here, the biggest plane of motion is rotation, but there is also two other planes of motion involved. So this leg here is in flexion, abduction, and external rotation, and this one would be in flexion, abduction, and internal rotation. So those three planes of motion are involved. The question I got was, is it common, or do you have any recommendations for when people are in this position and they get hip flexor tightness / pain? Generally, I see that a lot. Generally, it's on this side, because this is the more compressed, internally rotated side. So this side, there's a lot more freedom to be able to move. This side, you're gonna get your compression, you're gonna have tightness here. And that's just based on the congruency of the joint. When things move into internal rotation, it tends to be a bit more compressive. So it is very common to have a guarding response here in the hip flexors. So to understand where the hip flexors are, we can think about most pants have a line on the outer seam and the inner seam. So basically anything within those two seams on the front side of the thigh can be considered a flexor. So we have some flexors on the inside that also adduct the leg or bring the leg inward. We have some more on the outside that move the leg outward. So on the outside here, you have this tensor fasciae lata area, which is attached to the iliotibial band, but it's just a little bit on the front side of this lateral seam here, and that often wants to get involved and sort of block this motion, because if there's a lot of joint compression here, it's basically a protection mechanism not to go deeper into a mobility you don't have. So the key over time to get this better is to add some isometrics that engage the hip extensors as well as other muscles around the area. So your core, for instance, your rotators, your ipsilateral rotators of your trunk, which would be mostly your internal obliques, so that you can work around and work into the direction you want to go with not having so much hip flexor activity. So one of the best ways to do that is figure out what are the hip extenders. You have your glute and your hamstring. Your hamstring is going to be the most important one here, because when I'm in this position and the knee is bent, it's going to be easier for me to get my hamstring engaged than to get my glute engaged, but there is a way to do both. So for the hamstring, what you want to be able to do is find the heel with the heel of your hand, and think of what the hamstring does. It bends the knee, but it's also, the attachment is right on the sit bone or the ischial tuberosity, so it tucks the pelvis posteriorly. So if I'm going to create a little bit of a pressure, isometric pressure on my heel, and then I'm going to think about bringing my sit bone towards the back of my knee, or I can think about just pulling the hip into the socket, it's going to create a little bit of activity on the back of my thigh here, and that'll also give me a sense of pulling me to the left, which is going to improve my internal rotation here. So if I can get some activity on the back side of the thigh, it will usually it'll sort of override the hyperactivity that's happening in the hip flexors there. The other piece of it would be to think about my belly button moving towards the left. So if I exhale and I pull my belly in, but I also feel like I'm doing a little bit of an oblique crunch to the left, I'll be able to get my internal obliques involved. So now I'm compressing myself to the left, so my nose is over the knee, but I have this backside activation, this hip extensor activation. The other value is if I think in the socket, I might actually get a little bit of adductor activation as well. All things that'll be able to get you possibly out of this overactive hip flexor there. On this side, if you're getting any of that activity, which is rare, you can engage the glute max by reaching forward. So the glute max is also it's a hip external rotator as well as a hip extensor. So if I reach this knee long and feel like it's moving into the ground a little bit, I can oftentimes feel the glute engage, which is again on the opposite side of the hip flexor, so it can help me calm some of that action down. If I'm on this side and I want to kind of get away from the compression here and I want to find my glute max, I could reach this leg long and just hover it up, which creates a little bit of an external rotation moment. And I can feel this on the backside glute, which is behind this hip flexor activity, and it can help to calm down some of that. So that's just a little tutorial on how to get out of the hip flexors when you're in this 90-90 or Z-sit position so that you can get into the hip extenders. If you have any questions, you can go to movementprofessional.com or you can hit me up on my email.